Hello, class. Welcome to week 5. We are almost on our way to being done. It's so exciting, right? Um, so I wanted to just thank you for all your hard work and your efforts. I'm really enjoying reading your discussion boards and seeing what you're learning from your vignettes that you're getting. This is going to become very comfortable for you, getting vignettes and having to write things about them. It's a big part of our learning is by looking at clients and trying to assess where they're at and diagnose. Um, and so this is just the beginning of that journey for you. You're doing a great job. Um, so I will be reading your papers and grading them this week, as well as your discussion board. So a lot of grading, but I look forward to doing so. I will be talking today about eating disorders. Probably all of you, most of you, will know someone that has had an eating disorder or some level of disordered eating. Um, Eating disorders are very serious because they are life-threatening. And that is one of the most life-threatening, high-risk type clients to have. It's one of the highest, like when we look at what kind of diagnosis could cause a death, eating disorders is one of them. And that is because of the harm it does to the body with the behaviors associated with the disorder. There's varying types of disorders. We will get into that here. But it is something to take very seriously. Someone with an eating disorder should be under medical care. Should be consulting a doctor. And, it's very scary. I have known people that have passed away from eating disorders. We know people in the public eye that have passed away from eating disorders. We probably know people in the public eye that we can tell struggle with eating disorders. Our culture, unfortunately, is very focused on how we look and how we age. And there's a lot of pressure to be a type of way, which we see that a lot often in Hollywood, of course, and how people then try to manifest that and taking that into their own hands. So there's issues when a person has an eating disorder. These are some things that they could be concerned about. Weight concerns, which feeling overweight much of the time, even when they're not, having a negative view of their weight, body dissatisfaction, dissatisfied or distressed with appearance, overinvestment in appearance, avoidance of certain situations or things because they elicit body concerns. Eating disorders, there's an intense weight concern, body dissatisfaction, marked severe restriction or lack of control over eating. Weight concerns exist on a continuum, including emotional and cognitive and behavioral components. I think too, eating disorders, they often coexist with another kind of diagnosis. So whether that be OCD, anxiety disorder, depression, oftentimes they coexist. And sometimes when a person has trauma in their life, whether it be abuse or really controlling parents or something, one way to control your life is by controlling what you eat. And that then becomes the fixation. So it can manifest in a lot of different ways. The epidemiology and features, anorexia nervosa, we hear about that often. I think it was Karen Carpenter. This was a long time ago. So if you are not a certain age, you may not know who she was. She was a famous singer. She passed away of an eating disorder. So refusal to maintain or a minimum normal body weight, have an intense fear of gaining weight, show disturbance in the way body shape and weight are viewed. Now, again, this is the kind that we tend to see more often, like in models or things like that, where you're very thin, see your bones, dancers, things like that. bulimia nervosa, binge eating, inappropriate methods to prevent weight gain. So binge eating type, like again, might eat a ton of food in a sitting and then just gorge themselves, right? We've seen this in different, there's this show actually, it was on Apple TV. It was called Physical, and she was like it was a very, like, I'm not saying you should go watch it because it wasn't necessarily appropriate, but it was like an 80s aerobics instructor, and it was so interesting because the way that they dealt with the eating disorder, it was interesting because they did it like she was like her eating disorder talked to her. It was like her negative self-talk you could hear. And it was so mean and it was so critical of herself, but you could hear it. And so it was just so interesting to be the viewer because you're seeing what she's doing and you're seeing all the things that she's experiencing. And then you just hear this negative self-talk that's telling her like, and she would punish herself by binge eating and then vomiting. It was actually kind of hard to watch, but that was her vice. That was her issue. And so that was like kind of interesting, observing that, in the show. Anyways, it was actually a pretty good depiction, I think, of what's going on mentally for someone struggling with this kind of disorder, the negative self-talk, the criticism, the body dysmorphia, the fear of like what my body's going to look like, things of that nature. Binge eating disorder, a lack of control over eating during a certain period that leads to discomfort. Anorexia nervosa, refusal to maintain body weight, intense fear of gaining weight. Again, dehydration, hypertension. The person I knew that passed away was due to a heart problem. And little did they know at the time, there was a heart condition, and I believe the eating disorder exacerbated that, right? Kidney dysfunction, osteoporosis, heart problems, dental problems, electrolyte imbalance. You'll see sometimes with the teeth and things of that nature, your body's not getting proper nutrients, your body's going to react. Binge eating episodes, like I mentioned, that's like overeating, like, going to, let's say, fast food and eating more than just one value meal. You're eating like 5, it's just grossly inappropriate, right? Self-evaluation greatly influenced by body shape and weight. Episodes often triggered by depression, stress, or low self-esteem. And again, dental problems from vomiting, salivary glands, that's your tongue, that's your mouth, swollen, esophagus problems, which you can rip or tear it from vomiting, bowel problems because of everything going on with your bowels, chronic diarrhea, especially if people, sometimes people don't vomit, they'll use laxatives. You can really mess up your digestive system using laxatives. Your body may not work how it should, as a result of what you do, it can be pretty disruptive to your whole body. Binge eating disorder, episodes without compensatory, there's not episodes without the behavior. Eating more rapidly than normal, eating despite often uncomfortable fulfilling, eating when not hungry, eating alone, feeling disgusted, depressed, or guilty, varying level of obesity, and enrolling in weight control programs. So we're looking at symptoms. So when you're looking, you have a client in front of you, you're checking these symptoms, seeing what criteria they meet, and trying to navigate, like, does this person meet this mold? Assuming, some people are going to come to you and they already know they have the diagnosis. Maybe they went to a doctor and the doctor's like, you got an eating disorder. You got to figure this out, man. And so they enroll in therapy, right? So clients may already know that they have it. Other clients, you're like, I don't know, like they're talking about some of their issues and you're like, I think this is a problem. Okay. So again, the peak of age of onset for anorexia nervosa is during adolescent years, may be more common in industrialized societies. I think societies where there's room to be more particular about our bodies and things of that nature, you're going to see more of that, more pressure on appearance. Probably some other countries where, the focus is more on survival and whatnot, you're not going to see as eating disordered behavior because maybe the attention to appearance and the body in that way just look different. Peak age of onset of bulimia is between 15 to 20 years old. Eating disorders, more common among women, 2.6%, 0.7%, although rising in men. Rates of eating disorders are similar among Asian, Black, Latina, white women in the United States. Anorexia nervosa reported worldwide and not solely attributed to Western thinness ideals. So meaning it can happen anywhere. Bulimia cases in non-Western countries linked to Western thinness ideals. So those are a little different that way. And like I said, I don't think an eating disorder has to do necessarily always with body. I think sometimes it can have to do with control. And how do we control something is with our food. When you think of children and when they're especially in environments where they don't have a lot of control, one thing that they can control is what they put in their mouths and what they don't. And so that's with food. So eating disorders highly are aligned with other disorders. So, personality disorders, potentially anxiety disorders, depression, like I mentioned, other eating disorders. Now you got to remember there's other ways to also like over exercise can be a problem, right? Like it could seem like, oh, I'm fine, but we'll see this a lot of times in runners. They're running so much, like they feel like they have to run so much, or they exercise so much to kind of counterbalance how they feel about their bodies or their comfort in their bodies. And that negative kind of feelings that they have after eating, and then they'll go exercise. It's a problem. It's too much exercise. It's not a health. Like I feel like it's like I eat, I need to go do something. I eat, I need to go do something. It's just not very good behavior, right? So some stigma research suggests many blame those with eating disorders for their problems. Eating disorders are self-inflicted and related to willpower, meaning if you just had a little bit more willpower, you wouldn't have this problem. People with eating disorders often self-stigmatize, making them less likely to seek treatment. Yes, and oftentimes if other people in their lives don't know about it, then it's a very private problem until they get caught. And then there's a lot of shame and guilt and all those kinds of things, especially if you get caught vomiting. I think with anorexia, maybe it's more obvious because the person's getting thinner and thinner and thinner. But sometimes people mask, they cover it up and wear layers of clothing to try to not make it so obvious, right? But it's very problematic. So just something to be aware of, okay? Biological risk factors for eating disorders, genetics, brain features, hypothalamus, which, and nucleus accumbens, serotonin, mostly closely associated with dopamine, may play roles, right? Dopamine makes us feel good. Perfectionism, rigidity, and impulsivity. Sometimes in anorexia, you'll see a pressure to be perfect, and this pressure to do everything right. And that could be something like that control piece. And that's where I see like that coexisting, sometimes OCD, anxiety type disorder, along with eating disorders because of that pressure to do things like a type of way. Oftentimes that's not necessarily the case with binge eating, but with the starving piece, because honestly, to starve yourself, it requires a level of control. And that's the thriving, right? Like I thrive off that control. I feel more in control when I'm starving. I know it sounds so strange, but it's what somebody gains from this type of methodology to for their body to stay a type of way, right? Um, so, and again, outside people could be like, well, this is very selfish. Like, you're doing this to yourself, all these kinds of things. Why don't you just eat? Just eat. It's just simple. Now, you'll see a couple variations of different kinds of eating disorders. I mentioned the overexercise. There's this new thing. Some of you might know about it, have heard about it if you have young people in your life, but a fear of vomiting. And as a result of being fearful of vomiting, people then are very restrictive in what they're going to eat because they're afraid it's going to make them throw up. So that might feel like, oh, that's like a specific phobia, like, oh, fear of vomiting, but like a fear of contamination. So if the food is contaminated, then I'm going to throw up, and I don't want to throw up. So then their food becomes very restricted. It's kind of a popular TikTok-y thing, YouTube-y thing. Kids are talking about stuff that's going on for people. So anyways, something you might come across as you work with young people of today. Criticism of body, you have to be very careful how you talk to your children about their bodies, their weights. I remember, COVID, dark days for all of us. We're all home and we're having to live this sedentary kind of lifestyle. And I remember my son kind of thickened up a little bit. He wasn't going to recess. We couldn't go to school. And he got kind of thick. Plus, he's in those prepubescent years during that time. And I remember taking him to the doctor. He's doing his well baby check. And the pediatrician's like, oh, mommy, maybe one cookie instead of two. And it was her way of kind of passively saying like, hey, watch it. He's kind of thickening up. And, but I feel very responsible as the parent. Like, I'm in charge of like what he eats, the snacks he has, the food I give him, so like, am I going to fat shame my child? No, but some people do. And they feel like that's going to be what it takes to motivate them to lose weight. Now, kids, our bodies go through different stages in life. And like, as we know, like during a puberty stage, there's sometimes as they're transitioning from, pre-puberty to puberty, to after puberty, like, our bodies are shifting, they're changing. There's layers of fat that happen, right? That then get shed. And so telling someone they're fat is not the way for someone to lose weight. It's not motivating. If anything, it's going to make someone self-conscious. And some people are like that. Some of you might remember your parents being very critical of your appearance. Like, why are you wearing that? That looks terrible on you. Now, not saying we shouldn't have some constructive criticism. If something looks really unflattering on somebody, I'm not saying you should wear it anyways. But it's just this level of like constantly having something to say. We don't need to constantly have something to say, yeah. So it's just one of those things where, again, people can be very critical of appearance. Getting picked on in school, bullied for an appearance, might make someone self-conscious enough to want to kind of try to do extreme measures to lose weight and get fixated on that, obsess over it. And, again, our society has a thin ideal of what's normal, but like, as we know, everyone's body and body type are different. So, body dissatisfaction is going to cause a higher occurrence of something like this happening, than someone who doesn't have body dissatisfaction. Okay. So, I think it's something to take into consideration when parenting or when talking to kids or people about, what kind of started this whole way of living. And you'll find that these kinds of things will come up. You'll find that they'll talk about someone being critical of their appearance, or constantly never feeling good enough, or constantly feeling like I need to be perfect to be loved. I need to look a type of way to be loved. And so their whole value of who they are as a person is wrapped up into this one part of themselves, which is just one part. There's a book, it's called Life with Ed, which is about eating disorders. And the book talks, it's like the person is like talking to the eating disorder, kind of like I mentioned in that show. But in the book, you see the struggle, right? The struggle of what it's like to have this life with Ed, which stands for eating disorder, and how toxic it is. You know, it's a toxic dynamic, a toxic relationship. It's unfortunate. Prevention of eating disorders. Many risk factors for eating disorders occur in an early age. So eating disorder prevention programs emphasize education about eating disorders and consequences, resisting cultural social pressures, which we see that more now in commercials and television. We've seen that with different people that are of varying sizes and just talking about their body. And I think the main thing with kids is really promoting being healthy. My kids have some teachers that are really into being healthy. And just talking about like food and like what food is healthy. Like I think one of my kids, I was talking about Takis or something. And I don't buy Takis for my children, but we were talking about them. And my son's like, if you have those, you're gonna die. And I'm like, okay, like having Takis one time is not going to kill you. Eating Takis every day is probably not entirely good for you. Okay. Or all day long. Like I make it kind of dramatic. I tell them nothing all the time is good, usually. So, you know, yes, like if we were to just only eat like vegetables and not the right kind of vegetables where you're getting a good mix of protein and whatever, it's going to be problematic. You know, if I just ate apples all day long, like that's problematic, you know? So I try to explain to them the extremes are not good. Like having fast food every so often isn't terrible for you per se, but eating it every day, all day long is a problem. So trying to talk to them about what is healthy, and to be healthy, right? Like the goal is to be healthy. We want to take care of our body, one, because it's God's temple, but also two, because it's important for us to take care of ourselves and to treat our bodies well if we want our bodies to last and be healthy and be able to do fun things and be active. Like we got to take care of ourselves. So I'll talk to my kids in that kind of way because I want them to be healthy people. I want to be a healthy person, right? So mom exemplifies that. Like I like to exercise, you know. I have time that I it's in my home, you know, I don't leave necessarily my home to exercise, but I'll go into this area in our home and I'll exercise. And it's usually some time I'm by myself, which is like wonderful. But it's like I try to demonstrate healthy behavior because they're modeling what they do after what I do. Going back to talking about our bodies, I don't talk negatively about my body in front of my children. A lot of parents will talk negatively about themselves or constantly dieting. And so, yeah, they may not be critical of their kids' bodies, but they're critical of their own bodies and their kids are observing, right? Kids absorb what you do, you know? And so these are things like even if you had a minor having a problem with an eating disorder, you might be wanting to talk to the parents, like, how are you modeling behavior? What are you talking about? Are you constantly on a diet? Do you kind of have some variation of an eating disorder? Those are things that could be going on at home. You know, that could be what's being modeled to them. And that's problematic, right? We used to do at CBU when I worked on main campus for years, we did Eating Disorder Awareness Week. It happens usually, I think, did it happen in the springtime? But there's some great resources online. There's the National Eating Disorder website. And just a lot of great things that they do to bring about awareness, to help people with how they feel, things of that nature. And so, you know, we have to make sure as clinicians we're taking good assessments. We are making sure that, like, again, they're going to doctors, getting blood work done, checking their heart, all those things. Eating disorder care, like once someone's severe enough and they have to go inpatient or intensive outpatient for eating disorder care, it's the most expensive care because you're involving a physician, psychiatrist, potentially therapist, dietitian. That's a lot of professionals in treatment. Okay. And that is expensive, right? And so insurance, there's been a lot of lobbying for insurance to cover eating disorder care. There's been times where it hasn't, and that's like detrimental to people, right? And there's a high relapse rate, things of that nature. But there's a lot of work that goes involved in keeping someone healthy with an eating disorder. Okay. Because again, people are, they're really stuck and really troubled. And so the dietitian is so important because they teach them how to eat properly, how not to focus on calories. Usually some intensive outpatient programs or inpatient programs have like a methodology of how to measure food appropriately. So it's a very expensive treatment. Okay. CBT is used, EMDR is used, especially if there's trauma. Yeah, so I think that's pretty much it in regards to this topic. I hope this was helpful to you. Some of you might want to work very specifically with that population, which is great. Others of you are like, wow, this is really intimidating. Again, you'll come across it, I guarantee you. It might not be something that stays on your plate very long due to the fact that it is high risk. However, it is something that you will see. So I hope this is helpful. Have a great week. We are almost done. It's wild. It goes by fast. Talk to you soon.